Hi, I'm Alisa Abesamis. I graduated from the University of Santo Tomas Faculty of Medicine and Surgery, and currently I am moonlighting and practicing as a general physician. So my goal for today would have to be to highlight the importance and benefits of optometrists and general physicians working hand in hand. As a physician, I am very confident that optometrists can already handle patients the first time. They can already detect diseases such as diabetes and hypertension, which are the leading causes of common eye problems. After which, there can be a good referral system between optometrists and physicians. So I encourage everyone to break down the barriers and stereotypes because at the end of the day, physicians and optometrists would want to work hand in hand in providing good and safe quality care. We have to remember that everyone has room for taking care and treating patients. This is not a competition, rather a collaboration and a good partnership brewing.
Okay, so speaking of collaborations, I'll give you an example. Kanina I saw a patient with subconjunctival hemorrhage. So this is a very straightforward diagnosis, di ba? This is a case that we see, tapos pag nakita natin, we'll just educate the patient, that it will go away in a matter of time, even, it's self-limiting. However, with this patient, it has been several times na kasi. So this issue has been a recurrent issue for the patient. So at this point, I would already be thinking there could be, an underlying issue such as
hypertension,
tension,
kidney problems. We could also think of neuro problems.
Yun. So, yun yung mga iniisip ko na. Now, having a doctor on board or an MD on board, I could already throw some ideas and also get her advice kung ano yung workup. And she can also order the test that we need to do for this patient. So, for example, for this case, ano yung pwede nating ordering tests?
For kidney problems, we could consider ordering BUN, CREA. For clotting factors, we could also check out the bleeding parameters and we could also refer to neuro just in case.
Yeah, it's not as straightforward as we thought kasi it's been a recurrent issue. So it's time to really explore what is behind this condition.
Having healthcare professionals like Dr. Alisa in the practice, it's like a one-stop shop for our patients. So it's very beneficial for them because they can go to our clinic and receive care for multiple ailments at a single location. And it's also beneficial for us because we learn a lot about the condition of our patients. And this in turn helps us care for them more.
Yeah. So parang it provides, a very holistic care for the patient. Tapos convenient pa for them. So this is a very ideal setup and situation and setting yun nga for the patient. Okay, so how about you, Dr. Felix? Any interesting case this week?
Okay. So I have a 29-year-old male patient. He was complaining of dizziness. So most of the time, ito yung mga nakikita nating cases talaga sa practice. Either headache, syempre blurring of vision, and ito nga, dizziness. So he came from an ENT already. So the ENT recommended him to go to an eye doctor, a vertigo specialist. Okay. So what I did all the visual tests, I did functional reserves test, accommodative and convergence tests. Halos lahat ng tests niya, normal naman. Sinabi ko kay patient, if I'm going to prescribe glasses sa kanya, it's not an assurance na mawawala yung dizziness niya. Kasi nga, si headache and dizziness, marami siyang causes. So, hindi pwedeng dahil sa medications niya. Pwedeng dahil sa, yun nga, ear problem. Which is, yun nga, sabi ng doctor na vertigo. So, ito na yung time na ni-refer ko siya kay Dr. Alisa to have other tests done.
So first of all, I tried to do the Rhine and Weber test just to see if there are any hearing loss. And then we also ordered some neuro workup just to check because he already was complaining of imbalance. And then after which, we did some pure tone of audiometry and then we sent back the results to the ENT so that they would also be aware of the results that we have.
So parang it's not just one doctor managing this patient, diba?
Yes.
You have the ENT, you have the opto, then you have the MD, and then we also have the OFTA.
Yeah.
who also referred. So, parang this is multiple doctors involved in the case of this patient. So, we're giving the best, very holistic care for the patient. So, I'm sure like us, you've seen cases or encountered cases which stumped you, made you think, what do I do next?
So you may see this as an opportunity for you to collaborate with other healthcare professionals. And if you want to know more, join us and register at the first National Convention of Professional OD Society.
This will happen on June 19, 2022 at around 9 a.m. to 6 p.m. at the Sixth Sense condominium.
See you there!